My name's Owen. I work in the School of Public Health and Preventive Medicine at Monash University. Together with my colleagues, we've undertaken a study to explore the long-term productivity burden associated with smoking in Australia. The health impacts of smoking are well described. It's known that smoking increases the risk of many cancers, notably lung cancer, and also increases the risk of cardiovascular disease and stroke, and chronic lung conditions such as bronchitis, among others. Studies from around the globe have shown that smoking decreases life expectancy, and we know that treating smoking-related disease consumes considerable health resources. In high-income countries, it's been estimated that around 15% of healthcare costs are attributable to smoking. The healthcare costs which accrue from treating smoking-related disease are a major component of what we call the direct costs of tobacco smoking. These are a considerable cost to society, but in our study we were interested in looking at another potentially large cost to society and a component of what's called the indirect costs of tobacco smoking, namely work productivity. When we look at a population that we know that tobacco smoking confers productivity losses through premature mortality amongst smokers, but there is also evidence from large occupational health studies which has shown that smokers on average take more sick days, so they have higher rates of absenteeism, and also have higher amounts of unproductive time at work, what we call presenteeism, when we might be present at work but not functioning at full capacity. Using this data, along with national smoking rates, workforce participation data, and mortality data from Australia, we've undertaken modelling to estimate the work productivity losses that will accrue for today's Australian smokers over the remainder of their working lifetime. We were also interested in understanding what this might look like in terms of the potential macroeconomic impact for our country. To do this, we've used a new measure called Productivity Adjusted Life Years, or PALYs. PALYs provide a way to look at productivity which can capture not only the years of productive working life lost due to premature death, but also the productive work time lost due to ill health, both in terms of time spent absent from work and unproductive time while at work, or presenteeism.
This picture conceptualises the idea of a PALY, which is in some ways similar to quality adjusted life years. One PALY represents a year of life lived at 100% productive capacity. But when we have ill health, which impact on productive work capacity, this is reflected as proportional reductions in the PALY. The extent to which a disease or condition might impact or penalise the PALY varies depending upon other factors, such as age. For our study, we used life table modelling to examine the impact of smoking on the Australian population over time. Life tables are used to measure mortality, survivorship, and therefore life expectancy of a population, or years of life lived. We can then apply productivity inputs to measure productivity adjusted life years, or PALYs.
Our study highlights that if we could apply tobacco control measures to further reduce the smoking rate in Australia, there are potentially substantial health and productivity gains that could be made. This is the first time that PALYs have been applied to look at the productivity burden of smoking, and we hope that this concept might be useful to others around the globe to understand the potential health and economic gains that can accrue to societies through tobacco control.